So, good morning, student.
Good morning.
Good morning, student. So, in the yesterday's lecture, we will learn about the glaucoma in detail with its classification, primary, secondary glaucoma, and after that, we will study about the homeopathic therapeutics of the glaucoma. In that, we will learn that homeopathic therapeutics of the glaucoma in that aconite, aurum belladonna, bryanalba, causticum, cedron, cocaine, colchicum, commodaclea, crocus sativa, gelsemium, maccarp, nux vomica, opium, ocimum, phosphorus, physostigma, prunspur, Rustock and Spigelia are very useful remedy in the cases of the glaucoma homeopathy. So in that we will learn about the aconite nepalus or met, belladonna, Brianna alba, causticum, citron, cocaine, colchicum autumnale, Commodaclea dentata, Crocus sativus, Gelsemium, Nux vomica, opium, and now till the opium we was learned in the yesterday's lecture. So now today's lecture is starting with the ocimum. That is, it is a useful remedy in the glaucoma and it is a rare remedy. So in the case of glaucoma with the iridescent vision, with the violent supra and infraorbital neuralgia, with the violent pain and lacrimation, is the key feature of the oscillum with that green color surround candlelight. So the vision of the patient that the patient sees the any object which is surrounded with the green color and candlelight. There is conjunctivitis, increase in intraocular tension, dim sight, and photophobia also seen in the oscillum. So in general, ocimum is a very rare remedy, but it is useful in the glaucoma when there is a vision is a green color surround candlelight. This is the character feature of the ocimum. And there is a violent pain and lacrimation with the violent supra and infraorbital neuralgia. With the conjunctivitis, dim sight, photophobia, and useful in the intraocular pressure when increased. So it is useful in a glaucoma. It is an irreversible condition. So next is a phosphorus. So when we can study about the phosphorus, objectively the patient shows their eyes are sunken and surrounded with a blue ring. So sunken eyes, which is surrounded with the blue ring, is a marked feature of the phosphorus. In that, eyes seem large due to the increased intraocular pressure, edema of the lid and around the eyes. There is a ptosis and myopia. Subjectively, the patient feels that there is a aching and burning pain in the eyes with the stiffness and heat. There is a dull pain after reading. So, subjectively, the patient feels that there is a dull pain, stiffness, heat, aching, and burning pain in the eyes. Vision. So, how the vision of the patient of phosphorus is that object look red, letters look red when reading. So, during the reading, object look red, later looks red. There is a hemerotopia, that is the day blindness, sees more distinctly in twilight than during the day. So, in the phosphorus, there is a day blindness. Eyes gives out while reading. The characteristic of phosphorus is that he is very sensitive to external information. And clinically, it is useful in a keratitis, in a glaucoma, in corneal opacity, myopia due to the increase or ciliary spasm, and has been reduced perceptibly with the 2x interval. So next remedy is a physostigma. Physostigma is useful in a follicular conjunctivitis, staphyloma after suppurative inflammation, increasing myopia, contraction of pupil. Then there is a twitching of ocular muscles, night blindness. See, the phosphorus is useful in a day blindness, but opposite that physostigma, it is useful in a night blindness. There is a photophobia, glaucoma with the flashes of light, partial blindness, paralysis of accommodation, profuse lacrimation, there is astigmatism and spasm of ciliary muscles with the irritability with after using the eyes, post-diphtheric paralysis of the eye and accommodation muscles. So next remedy is prunus spinosa. Prunus spinosa is the common name is a black thorn. It is useful remedy in a ciliary neuralgia with the glaucoma. There is a bursting pain in the right eyeball, the shooting like lightning to the brain, to the occiput with the sudden pain in the left eye as if it would burst and better by the lacrimation. So, prunus is a very rare remedy but it is useful in the glaucoma cases. When there is an increased intraocular pressure, so it is a irreversible changes of the eyeball when there is a bulging and bursting pain in the right eyeball with the shooting like lightning through the brain to the occiput, and there is a sudden pain in the left eye as if it would burst and better by the lacrimation. It is useful remedy in the iridochoroiditis, then the opacity of vitreous humor and eyes feel as if bursting. So eyes feel as if bursting is also a key feature of the prunus spinosa, but it resembles with the symptom of the glaucoma. That is, eyes feel bursting. There is a bulging of the eyeball. There is a very increase in the intraocular pressure that the patient feel that eye is bursting. So it is clinically resembles with the glaucoma. Then the rest. Rust of, as we learn in the homeopathic mathematics, it is useful when there is a swollen red edematous orbital cellulitis, then pustular inflammation, photophobia, profuse flow of yellow pus, then there is a edema of the lid, suppurative iritis, lid inflamed and agglutinated with swollen lids, then there is a glaucoma, old injured eyes with the circumscribed corneal injection, intensive ulceration of the cornea and iritis after exposure to the cold and damp. So Rostock is mainly used when there is aggravation from cold and damp wave of rheumatic origin. Eyes are painful on turning it on this. profuse gush of hot, scalding tears upon opening the lid, and it is worse by cold, wet, rainy weather, night, and during the rest. And it is better by the warmth and the dry. So the stuff feel better in a warm and a dry weather. So when we get think rust of mainly aggravate in cold, damp weather. So it is the characteristic feature of the rust of with the rheumatic origin. All complaints are related or associated with the rheumatic. Then, corneal inflammation due to the foreign bodies with the fileticular keratitis, staphyloma after a suppurative inflammation of the cornea, and corneal ulcer is a useful when there is a use of the stop in the cases of the glass. So next one is the spigelia. The common name of spigelia is the pink root. So eyes feel too large and pressure pain on turning them. Eyes feel large. So why he feel the large as there is increased intraocular pressure in the glaucoma more than now. So there is a glaucoma, pupil dilated. Pupil dilated, eyes feel large. This is the symptom of the glaucoma. Photophobia, then rheumatic ophthalmia, severe pain in and around the eyes, extending deep into the socket. There is the ciliary neuralgia and the true neuralgia. And worse from the touch, motion, noise, turning, washing, concussion, and better by lying on the right side with the face and east. So, the spider is also a great useful remedy in the cases of the glaucoma when there is a eyes feel large, pupil dilated, photophobia, rheumatic ophthalmia, severe pain in and around the eyes, extending deep into the socket, then ciliary neuralgia, a true neuritis, and worse from the touch, motion, noise, turning, washing, and touch. So it is better by lying on right side with the head and it. So next topic of today is the diseases of the eye. So when we study about the diseases of the eyelid, there is some congenital abnormality like symbelopharon, ankylopharon, ectropion, entropion, trichosis, coloboma, epicanthus, blepharophthalmos, ptosis, and all may occur as a congenital malformation. So, when the diseases of iris, we learn in that there are some topics are important like blepharitis, star, chalotheon. So, we can start with the congenital coloboma. So, it is a rare condition characterized by a full thickness, triangular gap in the tissues of the lid. So, the anomaly usually occurs near the nasal side. So, in this diagram, this is a diagrammatic representation of the congenital coloboma. In that, we can see there is a full thickness triangular gap in the tissues of the lid and involve the upper lid more frequently than the lower. So in that we can see how the upper lid is involved more than the lower. And treatment consists of plastic repair of the lid. So it is mostly occurs near the nasal bone and in the upper lip. So it is a rare condition and characterized by the full thickness triangular gap in the tissues of the lid. A notch at the edges of the lid, most commonly in the middle of the upper lid. So it is mostly placed at the middle of the upper lid and often associated with the underlying dermoid cyst, and treatment is by plastic repair at every early age to prevent exposure to the chemical. And next topic is blepharitis. So when we study about the diseases of the eyelid, blepharitis is the most important chapter. So now we can study the blepharitis. Blepharitis it is defined as a subacute or the chronic inflammation of the eyelid margin, that is meeting place of the skin and conjunctiva. So where the skin and conjunctiva are met, this is a place when there is a chronic or subacute inflammation of eyelid margin, then it is called as a blepharitis. So we can study in the previous lecture we was study about the anatomy physiology. In that we can study we was learn about the eyelid margin. And in the eyelid margin, when there is the eyelid margin means what? It is a meeting place of the skin and conjunctiva. This is called as the eyelid margin. And these eyelid margin when have a chronic or subacute inflammation, then it is called as the blepharitis. And etiology is the predisposing factor, that is age usually seen in a children at any age group, usually bilateral, external irritation, that is the dust, wind, smoke, and fog. Unhygienic conditions are strained due to the error of the. So, when blepharitis is the subacute or chronic inflammation of the eyelid, an etiological factor that is mostly seen in the children, usually bilateral, and irritation from the cosmetics, dust, smoke. It is due to the uncorrected refractive error, that is rubbing of the eye to gain a clear vision, and it leads to the chronic seborrhea, that is dandruff of the scalp, mainly in the squamous cell, and due to the chronic conjunctivitis. It may be due to the parasitic infestation like the Blepharitis carica due to the Demodex follicularum and Thysis palpita due to the Crabolus thysis group. So constitutionally, when there is a nature of the skin, that is when there is a seborrhea, which is also lead to the blepharitis. Because there is excessive carbohydrate diet, then toxic factor, septic focus, allergic factor, eczematous skin, inflammation of the neighboring structure like conjunctivitis, dacryocystitis, and to summarize that there is a dirt and staphylococcal infection in the children with the seborrhea in adolescents and allergy in adults. So these are the main causes of the plague. So next is the clinical of plague. So when we study the clinical types, there are two types of the blepharitis. First one is the squamous blepharitis and second is the ulcerative blepharitis. So we can start with the squamous blepharitis. It is a non-infective, metabolic, symptoms are no pain, discomfort may be present, untreated epiphora due to the anatomic changes in the lymph node. So this is a seborrheic dermatitis, seborrheic blepharitis. In that, how we can see the diagrammatic representation of seborrheic dermatitis, sorry, seborrheic blepharitis. In the signs, there is a white scale dandruff line on the lid margin. So in that we can see that how there is a dandruff line white scale. On removing the scale, there is a hyperemic but no ulceration. Falling of eyelashes, they are quickly replaced and thick lid margin. So when we study a squamous nephritis, it is characterized by hyperemia, usually limited to the eyelid margin, and it is not an infective condition. Symptoms of it are there's a redness of eyelid margin, then burning and discomfort of the eye with the epiphora. Epiphora is that there is overflow of the tears onto the face. Then there is a white damper like a scale on the lid margin. With that, there is a, on the removal of the scale, underlying surface is found hyperemic, but there is a no separation. So this is also important point with the falling of the eyelash. Falling of the eyelashes is called as the macros and thickening of lid margin. That is the stylus. With the associated seborrheic dermatitis of the second type is the ulcerative blepharitis. Due to the infection, that is the Staphylococcus infection lead to the ulcerative blepharitis. In that suppurative inflammation of the ciliary follicle, symptoms are soreness of the lid margin. There is a lacrimation, itching, and photophobia with the signs that is the yellow crust at the root of the eyelash. Eye, eyelashes are glued together. On removing the crust, some small ulcers appear around the base of the eyelashes which bleed in. There is a falling of eyelashes which are neither not replaced or when replaced, it is a missed. So this is the diagrammatic presentation of ulcerative colitis. It is caused by acute or chronic suppurative inflammation of the follicle of eyelashes and gland of breeze and Staphylococcus aureus is usually the causative agent of superimposed and predisposing conditions. The symptoms of it are itching, then there is a lacrimation, redness, sore, soreness of the mid margin, and loss of so there is a loss of the sign is a yellow crust are deposited at the root of the eyelashes with the meeting. Then there is the crust are removed with the difficulty and bring the eyelashes with it. On removing the crust, the small ulcers are seen around the base of the eyelash. So there is a small ulcer formation at the base of the which bleed easily. And there is a loss of cilia with the distortion of the eyelid margin or misdirected cilia. The sequelae of blepharitis is that These are mainly seen in ulcerative form of blepharitis and often severe. So, if treated, if it is not treated in time, then mitosis, that is the scanty eyelashes, trichitis and tylorosis, that is the hypertrophy of the lid margin due to the development of cicatricial tissue and drooping of the lid. Then ectropium, that is eversion of the lid margin, and it causes constant episode. So, when there is a chronic conjunctivitis and loss of eyelashes due to the destruction of the follicle by the deep ulceration, it is called as madrosis. And trichitis, that is when ulcer heals and cicatricial tissue contract with the misdirection of the remaining skin. And tylosis means that is the hypertrophy of the lid margin with the consequent drooping. So there is a drooping of the lid and ectropion, that is lower lid with the epiphore, and marginal keratitis is particularly seen in the lower lid third of the cornea, and instability of the tear film with the consequent rise. Then posterior blepharitis. So when we can study about the posterior blepharitis, that is the mebomitis. So the chronic mebomitis is a meibomian gland dysfunction seen more commonly in the middle-aged person with the acne rosea and seborrheic dermatitis. It is characterized by white, fluidy, foam-like secretion of the eyelid, margin, and canthus. The meibomian seborrhea. So this is a diagrammatic presentation of the posterior blepharitis, that is the chronic meibomitis. In that, we can see on the eversion of the eyelid, the vertical yellow streak shining through the conjunctiva is seen at the lid margin. And there is the opening of the meibomian gland become prominent with the thick. So, so the posterior blepharitis shows that there is a meibomian gland dysfunction. It is more commonly in the middle-aged person with sclerosia and seborrheic dermatitis. Next one is a parasitic blepharitis. Blepharitis acrica refers to a chronic blepharitis associated with the Demodex folliculum infection and Thyrosis palpabrum to that due to the crab lungs and very rarely to the headache. In addition to the feature of the chronic blepharitis, it is characterized by the presence of snip at the lid margin and at the root of the eyelash. So treatment is that there is a consist of mechanical removal of the lid with the forceps followed by rubbing of antibiotic ointment on the lid margin and delousing of the patient's other family members' clothing and food. So mostly there is a mechanical removal of lid is useful with the forceps and by rubbing the antibiotic ointment to the lid margin and Other family member is delousing with the clotting. So this is a more useful treatment compared to therapeutic. So this is a crisis palpable. So how in that we can see the crisis palpable is that and how this is the infection of the lid margin at the present that is the meeting point of the skin and this is the conjunctiva. So next is the treatment. In the treatment of blepharitis, where both the types are useful, firstly the general treatment and local. So in the general treatment, there is an improving of general health in the children is very important. Balance that with the vitamins, mostly the vitamin A is useful in cases of blepharitis. Removal of septic focus, that is the tonsil. So removal of the tonsil is the main important general treatment of correction of error of reflection. So it is also useful when there is any error of reflection, that is, it is required to correct it. The treatment of seborrhea of the treatment of the chronic conjunctivitis, that is chronic bacterial and in the local treatment, remove of the skin and crust with the 3% soda bypass. Then antibiotic ointment like gentamicin and chlormycetin used 3 times in a day. After healing of ulcer, hydrocortisone ointment 1% 3 times in a day for the congestion and allergy and treatment of tritiasis, atropine is also useful to treat the blepharitis. So, this is the general and local treatment of blepharitis that is useful allopathically. In that case, we will study about the how to improve a general health of the children, balanced diet, vitamin, that is mostly the vitamin A, removal of septic foci, that is tonsillitis, correction of the error of refraction, treatment of seborrhea of the scalp, then treatment of chronic conjunctivitis, chronic blepharitis, and locally there is a removal of the scale and crust with the 3% and antibiotic ointment that is gentamicin, chlormycetin, and after healing the ulcer, hydrocot ointment 1% TID for the congestion and allergy with the treatment of tritiasis, entropia, and so and we see there is a local and general treatment. There is also a homeopathic treatment for the flu. So next topic is the homeopathic therapeutics for the blood. In that there are two types, that is acute and chronic. So firstly we can see that homeopathic therapeutics for the acute blepharitis is that aconite napellus, apis mellifica, argentum nigricum, arsenic album, chamomilla, digitalis, delcamara, euphrasia officinalis, piparacel, creosote, mercuriodum flavum, mercurus rub, merc sol, nitrous earth, petroleum, pulsatilla, rust stock, sulfur, copper, and urine are useful in the acute blepharitis. That when we treat homeopathically acute blepharitis, these are the important. Next is a homeopathic therapeutic for the chronic blepharitis. In alumina, antimcrude, argentum nitricum, oral, med, barita, borax, calcareous clemitis, euphrasia, officinalis, graphitis, parcel, jugal, then mercor, mercurus, petroleum, sorinum, sepia, Cilicia, Staphylococcus, sulfur, tellurium. These are the important remedies are useful in the chronic blepharitis when we treat it home. So we can start with the aconite necklace. As we learn in the homeopathic medica that aconite necklace is the best remedy useful in the eye complaint that objectively when there is a patient shows that leads are red swollen hard, especially in the upper and in the mouth. And eyes are sore, inflamed, there is chemosis, conjunctiva intensely hyperemic, and edematous mostly toward the inner and lacrimation slight. Subjectively, the patient feels that eyes are burned, feel dry, there is sensitive to air, there is much aching and heat, intense burning, shooting pain, pressure upon the upper lid as if balls were pushed into the orbit and causing a bluish pain in the eye. So these patients experience that is with the itching, smarting in the evening, the eyeball, especially the upper half, sensitive, it moves, looking down,